The role of the All India Institutes of Medical Sciences, AIIMS, extends far beyond medical education and tertiary hospital care. As institutions of national importance, AIIMS centers occupy a critical position in public health leadership, health policy formulation, and national emergency response. Their expertise, infrastructure, and human resources make them indispensable during routine public health planning as well as during crises such as epidemics, pandemics, natural disasters, and large-scale health emergencies. AIIMS represents the interface where science meets governance, ensuring that public health decisions are guided by evidence, ethics, and clinical reality. AIIMS, as a pillar of India's public health system, public health focuses on prevention, population-level interventions, and long-term health outcomes rather than individual patient treatment alone. AIIMS contributes significantly to this domain through its departments of community medicine, preventive medicine, epidemiology, and public health research. AIIMS conducts population-based studies on disease prevalence, risk factors, health behavior, and healthcare access. These studies generate reliable data that help identify public health priorities, monitor disease trends, and evaluate the effectiveness of national health programs. By linking hospital-based clinical data with community-level research, AIIMS provides a comprehensive understanding of health challenges faced by the country. Contribution to national health policy formulation. One of the most influential roles of AIIMS is its contribution to health policy and advisory functions. Faculty members from AIIMS regularly serve on expert committees, advisory panels, and task forces constituted by the Government of India. Their recommendations influence policies related to disease control, medical education, healthcare financing, and public health preparedness. AIIMS experts contribute to drafting clinical guidelines, treatment protocols, and standard operating procedures that are adopted nationwide. This advisory role ensures that policies are grounded in scientific evidence and real-world clinical experience, reducing the gap between policy intent and practical implementation. Role in disease surveillance and epidemiology. AIIMS plays a crucial role in disease surveillance and epidemiological monitoring. Through continuous reporting, research, and collaboration with national health agencies, AIIMS helps detect emerging disease patterns, outbreaks, and health risks at an early stage. Its hospitals often serve as sentinel centers for identifying new infections, antimicrobial resistance trends, and changes in disease behavior. Early detection and reporting by AIIMS enable faster public health responses, minimizing the spread and impact of diseases. Leadership during epidemics and pandemics. The importance of AIIMS becomes most visible during epidemics and pandemics. During infectious disease outbreaks, AIIMS institutions often lead in diagnosis, treatment, clinical research, and protocol development. Their laboratories play a key role in testing, validation, and scientific analysis. During national health crises, AIIMS doctors and scientists help define case management guidelines, infection control measures, and vaccination strategies. Their role in training healthcare workers across the country further strengthens national response capacity. AIIMS and COVID-19. A contemporary example, the COVID-19 pandemic, highlighted AIIMS' critical role in emergency health response. AIIMS institutions were at the forefront of patient care, clinical research, and policy advisory. They managed severe cases, developed treatment protocols, conducted clinical trials, and provided continuous guidance to policymakers. AIIMS experts were instrumental in addressing issues such as ventilator management, oxygen therapy, vaccine safety, and post-COVID complications. This experience reinforced AIIMS' position as a national crisis response institution. Disaster management and emergency medical response. Beyond infectious diseases, AIIMS plays a vital role in disaster management. Natural disasters such as earthquakes, floods, and cyclones require rapid medical response, trauma care, and coordination. AIIMS hospitals, especially their trauma and emergency departments, are equipped to handle mass casualty situations. AIIMS also contributes to disaster preparedness by training healthcare professionals in emergency medicine, trauma care, and disaster response protocols. This capacity-building role strengthens national resilience against unforeseen emergencies. Training and capacity building for public health. AIIMS contributes to public health, not only through service and research, but also through training and capacity building. It conducts specialized training programs for doctors, nurses, public health officials, and administrators. These programs enhance skills in epidemiology, health management, emergency response, and policy implementation. By strengthening human resources, AIIMS indirectly improves healthcare delivery across the country, especially in resource-limited settings. Ethics, trust, and public communication. In times of public health crisis, trust and communication are as important as medical intervention. AIIMS plays a key role in public communication, helping dispel misinformation and providing scientifically accurate guidance to the public and media. Its reputation for credibility and integrity makes AIIMS a trusted voice during emergencies. Ethical guidance provided by AIIMS experts ensures that public health measures respect human rights, equity, and transparency. Challenges in public health engagement. Despite its strengths, AIIMS faces challenges in public health engagement, including high workload, resource constraints, and the complexity of coordinating with multiple agencies. Balancing routine healthcare delivery with emergency response demands continuous adaptation and support. However, AIIMS institutional experience and commitment enable it to respond effectively even under pressure. Future role in national health preparedness. Looking ahead, AIIMS is expected to play an even greater role in health system strengthening, pandemic preparedness, and digital public health. Integration of data analytics, artificial intelligence, and telehealth will enhance surveillance and response capabilities. AIIMS leadership in training, research, and policy will remain central to India's public health future. Conclusion. In conclusion, AIIMS serves as a cornerstone of India's public health, policy advisory, and emergency response framework. By combining scientific expertise, clinical excellence, and ethical leadership, AIIMS ensures that national health decisions are informed, effective, and humane. Its role during routine public health planning and national emergencies underscores its importance not just as a medical institution, but as a guardian of the nation's health security.